I came to this hospital because my son Keanu Conway, he's 2 years old now. So when he was 3 months, he actually had an incident where he completely stopped breathing, and we had to revive him at home, and we rushed him to the emergency room, and they suggested that, they stabilized him first, and then they suggested us to come here to Aster Hospital, and they said that they have a good team here, PICU team, who deals with these respiratory issues. So at first they thought that it was just an aspiration, as in he aspirated some of his milk into his lungs. So he was stabilized and he was fine when we came here to the emergency. But when they tried to take blood from him, that's when he collapsed again. And then it took a team of doctors to actually intubate him and rush him to the PICU. They informed us that after 11 days, they would take him to the operation theatre and they would see how he would do, like, under observation. And once they did a check at the upper airway, it was collapsing every time they removed the tube. So they did an emergency tracheostomy. Once they did that, they observed him again for another 2 weeks, and they found that he was unable to sustain his breath for even for half an hour. So they decided to keep the tracheostomy, and they said that maybe another 3 to 6 months he would be fine. So they had done another check and they found out that his epiglottis was a bit floppy. So it kept collapsing into his trachea. And so what they did was they told me they'd keep him here for another month. So for a month we stayed here at the hospital, and he was doing fine with the tube. He had no issues when the tube was in, but every time they took it out, he would collapse. So that happened about 5 or 6 times. And then after a month, they said that it'd be better if we go home because they didn't want him to get any infection. So the doctors and the nurses, they were really helpful. They taught me how to do the suctioning and how to take care of him at home. And they also helped us get a home nurse who would come along with us and stay with us for 24/7 at home, who would help with baby. So that way they were really helpful. Doctors were extremely attentive. When we were here for that entire 1 month, they took care of him really well. Most of the time he was on a ventilator, so I was not able to stay with him, but the nurses stayed by his side like the entire night, and they kept him calm, and they fed him and gave him his medicines and took care of him. Yeah, that was a really bad time, but they really helped us through that entire situation. They also got psychologists who came and spoke to us a little while after the incident, because that was really traumatic for us. Dr. Chetan was very helpful. He gave me his phone number. He told me to contact him at any time. After about 3 or 4 months, Dr. Srikanta came in, and he's the one who took care of Keanu from the time till date. So he finally diagnosed that Keanu has a tracheal Broncho Malacia, which means his trachea was completely collapsing in, and his entire left bronchi passage was collapsing. So he said that it will take a little longer. So after 9 months, he put another tube called the T tube, which allowed Keanu to use both the upper airway and breathe through his throat. So after that tube, Keanu actually improved a lot, and now he's doing really well. They've removed the tube after 2 years. They were able to remove the tube, and now he's doing really well. And thanks to Dr. Srikanta and Dr. Chetan, because they really took care of Keanu when he was in the hospital, and they made sure that everything was well. And now he's able to talk. After 2 years, we heard his voice. He's able to talk, and he's talking a lot now, and he's doing really well. He's breathing perfectly, and thanks to Dr. Chetan and Srikanta and the entire PICU team, thank you so much. And the nurses and the helpers, they all were amazing. Thank you so much.